And we'll take a few questions before we break for lunch.
A common, a common side effect of IPF and its medications is dramatic loss of weight and suppressed appetite, which I have experienced, and I wondered what recommendations you would have for regaining at least some of that weight.
That's a great question.
Barbara?
Am I on? Yeah. Did I understand you to say you have a loss of appetite and you need? For the IPF?
Yeah, from our medications.
Okay.
Yeah.
Thank you. If you were, my patient to come to my clinic, we spend a lot of time talking about how you got there and what it was like before, so we could have some understanding. But generally, I tell people I didn't get to spend a lot of time on the slide, is to be very intentional and to set your phone to alarm, or to have someone in your family call you or coach you or set a timer, and that you're just going to have a little bit of food. I tell people, get a digital scale, keep it at home, wake up in the morning, void, pee, and then weigh, and get a baseline home weight, not what you weigh at clinic or at the rehab, but you need to know what you really weigh at home after you wake up, after you pee, before showering or any fluids. Get your baseline, and then you're going to go in the kitchen and you're going to drink 12 to 16 ounces of water to rehydrate, because you've lost a lot of moisture overnight. And then you're going to be intentional about having something that has protein and some type of a carbohydrate, which is the protein is that purple or blue section, which is dairy as well. And then I'm going to have a whole grain or a fruit or a veggie. So that could be, I'm going to have a half a peanut butter sandwich with some sliced banana, just a little bit of food. And then I'm going to notice what time it is, and then 2 hours later, I'm going to do that again. And I'm going to do it 2 hours later and 2 hours later. Because what happens with appetite loss is kind of like this clinical word called anorexia, which just means I have a loss of appetite. So your brain's interest in food is going away, initially induced by the medication, but now secondarily, your stomach is shrinking. So this whole downward spiral is happening where it's like, it's okay, we don't need to eat, we're fine. So we have to break that cycle by being intentional. It's just set a clock, have a plan, have the food there. Don't go, ding, the timer went off, I don't know what to do, because you won't do it. Because the difficulty breathing is overpowering. So I hope that helps.
More questions?
This question's for Lisa, I think. What about sinus conditions, things like postnasal drip impacting the cough, and particularly at night? I've heard a lot of comments from people, myself included.
Yeah, so one of the top 3 causes of cough is postnasal drip, bronchiectasis, and then reflux. So we've hit, with this, we've hit on 2 out of the 3. Postnasal drip can be even more challenging for patients who require oxygen, because oxygen in and of itself is very drying. So what does your body do to combat that? It makes mucus. And then you have more drainage. So in general, we have some fairly decent over-the-counter strategies that are grandmother remedies, really. That saline nasal spray, it is our natural decongestant. Because you've got the salt water, it kind of shrinks the swelling. It moisturizes. It's the body's way of it's a natural way of moisturizing your mucous membranes, and you can use it liberally throughout the day. There are products that are more of a gel saline. I think Air makes one, NeilMed makes one, and they will cling a little bit better and kind of help with the moisturizing. It's kind of the more concentrated version. You want to avoid anything oily in your nose, because those things have been linked with kind of lipoid pneumonias or pneumonias related to inhalation of oil, so we don't want you necessarily to put Vaseline or anything like that. KY jelly, water-based stuff only. Saline wash kits, NeilMed makes one, and there are other ones out there can be very helpful for people who suffer allergies. We've got doing the saline first and then kind of chasing things with a inhaled steroid nasal spray. And then I get help from, when we get beyond that, I get help from my probably ENT first before allergists, because they'll do the scopes and really want to take a look. A lot of times my patients may be trying to tolerate CPAP at the same time and want to use a nasal device, and we find polyps or things that are easily kind of removable that may be helpful. And so it ends up being, when it comes more complicated, sort of getting help from otolaryngology and or allergy to combat that. But we don't necessarily, when it comes to allergies, promote immunotherapy, because we just don't know how that is going to affect the rest. But that's a great point. Thanks for bringing it up.
It is.
So we have time for one more question. I think we have somebody there already.
My question is in regards to pulmonary rehab, which I firmly believe in. I think it saved my husband's life and got him to transplant. I know it's a prerequisite for a lot of transplant centers. And in our area, there's a waiting list. And I was appalled recently to find that out in months to get into pulmonary rehab. And it's not specific for IPF patients or transplant patients. It's also COPD patients. But what's being done about that? Is anybody addressing the need, making more centers, or is Pulmonary Fibrosis Foundation aware? Is there something being done?
Yeah, it is a huge issue across the nation, honestly. And I think that's where the focus may start with telehealth and webinars posted online. You know, I can't stress enough, though, that the patients need to be seen initially to see what their safety kind of net is, and make recommendations from that. But yeah, it is a big problem. Another big problem we've seen too is cost. Where I live now, some of the co-pays are more than joining a gym for a year. Monthly co-pays are more than joining a gym. So, you know, it's check your insurance and just be the greasy wheel. But yeah, unfortunately, it's a big issue.
All right, thank you all so much, and we'll be up here for a few more minutes if you have questions.